Hi friends, welcome to the Nurses Academy. Today we will discuss about some of questions that is useful for your examination. First question, most important factor in therapeutic relationship is A. Trust, B. Knowledge, C. Professionalism, D. Motivating. So most important factor they are asking here. So main important factor in therapeutic relationship is the trust. A is trust. Trust is most important factor in therapeutic nurse and patient relationship. Next question. Who proposed model of preventive psychiatry in community mental health nursing? So preventive psychiatry in community mental health nursing proposed by A. N. Wick, B. Tattarai, C. Gerald Kaplan, D. Philippe Fihel. So C is Gerald Kaplan is right answer. Next one. A nurse demonstrates caring, sincerity, empathy, trustworthiness. A. Ethical nurse-patient interaction. B. Emotional nurse-patient interaction. C. Legal nurse-patient interaction. Therapeutic nurse-patient interaction. So a nurse demonstrates caring, sincerity towards work and empathy towards patient and trustworthiness. These are all comes under the therapeutic nurse patient relationship. The answer is D. Therapeutic nurse patient relationship. Next question. First phase of therapeutic nurse patient relationship is A. Orientation, B. Pre-interaction phase, C. Working phase, D. Termination phase. B. Interaction phase. Pre-interaction phase is first phase of therapeutic nurse-patient relationship. Next question. An important aspect of nurse-patient relationship is A. Therapeutic, B. Personal, C. Social and casual, D. So, important aspect of nurse-patient relationship is therapeutic, personal, social and casual. A. Therapeutic relationship only between nurse and patient should be have. Next question. The basic difference between the psychosis and neurosis. What is psychosis? What is neurosis? So A is clinical feature, B is severity, C is insight, D is duration of illness. Here psychosis means patient is having psychotic symptoms and neurosis means patient is having insight. Insight means what is meaning of insight? Insight means knowing of or aware of disease condition. So in psychosis, patient is not having awareness of about their own disease. And neurosis, example OCD and depression, OCD, somatoform disorders. Patient knows their own disease condition. But here in psychosis, patient is not having insight. So C is our answer. So in psychosis there is no insight. In neurosis patient is having insight. Next question. Nurses can help patient in an unknown area of Johari window by creating an environment that encourages A. Self-discovery, B. Self-esteem, C. Self-concept and D. Self-confidence. A is self-discovery. Our answer A. Self-discovery. So Johari window, we know it is having 4 columns. Known to self, others, unknown to self, and others like that. This Johari window will tell about the self-discovery of their patient, whether he is socialized, whether he is introvert, whether he is antisocial behavior. Through Johari window, we can discover ourselves what kind of personality we are having. Next question. Communication technique in which repeating the main idea of what the patient just said is. So communication technique is one of the technique in which in that technique repeating that main idea what patient just said is accepting, B. Restating, C. Reflecting, D. Broad opening. So this is reflecting because same idea he is repeating main idea of what patient just told. So that is called reflecting. Same thing what patient said, that one reflecting. So that we will call C is our answer. Next question. A client with paranoid schizophrenia has a delusion of persecution. He tells that the nurse, the CIA, is out to get me. They are spying on me. The nurse's best initial response is. So what is persecution. So what is persecution? Delusion means strong belief. Strong belief. Persecution means someone killing me or someone doing something to me like that. Patient is having delusion of persecution and patient is telling they are spying on me and they are out to get me. The nurse best initial response is A. How would they spy on you here? B. I don't want to hurt you. C. Tell me how they are trying to get you. D. I know that CIA wouldn't want to hurt. So always we should restate open-ended questions only. From the patient we need to get information. So what patient said now, again we have to try to ask same open-end question. Tell me how they are trying to get you. If we'll ask open-end questions, patient will give answer. If this is closed-end question, I know CIA wouldn't want to hurt you. Only this is closed-ended question and the patient won't open and this can cause the indifferent and situations. I don't want to hurt you. So if patient is asking, telling something, we should not again replying I don't want to hurt you like that, how they are spy like that. So we have to ask the question, open-end question, then patient can give information. Through that it will be useful for the treating the patient and also it will maintain the therapeutic nurse relationship. Next question. Choose the most therapeutic response to Mr. Sharma's question. Am I going to die? So what, as a nurse, how you will reply here? We all going to die one day. B is, what has your doctor told you? You really don't want to talk about death? Do you? D. Would you like to talk about your condition and prognosis? So here also we need to ask open-end question. D is our answer. Would you like to talk? Patient is, am I going to die like that? He is having some anger towards die. So as a nurse, we should ask, would you like to talk about your condition and prognosis? So patient can talk and whatever his fears are there, he can express. So as a nurse, we should ask open-end questions. Would you like to talk about your condition and prognosis? Next question. Excessive fatigue after minimal physical or mental exertion is called as. So minimal physical or mental exertion. So fatigue is called, means weakness, is called what? Anorexia nervosa A. B. Bulimia nervosa. C. Neurasthenia. C. Neurasthenia. D. Dissociative disorder. So answer is C. Neurasthenia. Means patient will feel for physical fatigue excessive and mental fatigue after exertion is called neurasthenia. Next, decreased perceptual response to a repeat stimuli is known as. So here we are giving repeat stimuli. So the perception is decreased. It is known as habituation. B. Selective attention. D. Undivided attention. D. Hallucinations is called habituation. This is known as habituation. Which term refers to perceptual abnormality? Attention A. B. Orientation, delusion, hallucination. Perceptual abnormality always is called abnormality in perception is called hallucinations. So we are having so many kinds of olfactory. We will perceive through our sense organs. Whatever sense organs is there, through that only we will get perception. Olfactory. Next, auditory. Hearing, through hearing. Gustatory, tongue. And then one more thing, smell completed and vision. Visual hallucinations. And skin, tactile. So through sense organs, whatever we will perceive abnormally, that is called hallucinations. Next question. Gustatory hallucination is effects on, already I have told. A. Nose. B. Taste buds. C. Ears. D. Skin. B. Taste buds. So if any abnormality in perception in gustatory, means whether we are tasting one thing, but we are abnormally perceiving another thing through taste is called gustatory hallucinations. Next, false perception of taste is termed as gustatory hallucinations, somatic hallucination, tactile hallucination, olfactory hallucination. A. Gustatory hallucination. Inability to verbally, emotionally, feelings. Describe once. A. Agitation. B. Echinacea. C. Alexithymia. D. Anhedonia. C is our answer. Alexithymia. Patient verbally or emotionally feelings, inability to express their one's own feeling is called alexithymia. Next, identification and interpretation of sensory input is. Sensory input. Identification, interpretation of sensory input is A. Cognition. B. Affect. C. Perception. D. Judgment. Already I said any sensory related interpretations we will call perception. Identification, interpretation of sensory organs we will call perception. Regarding sensory, only we will perceive. Answer is C. Perception. Hallucinations are disorders of A. Perception, B. Mood, C. Thought, and D. Cognition. Always perception. Hallucinations are abnormally perceiving of sense organs is called hallucination. Next question. Imaginary perception is called A. Delusion, B. Hallucination, C. Illusion, D. Magical thinking. So here perception, always perception regarding images through organ of eye. They are perceiving imaginary thing abnormally is called hallucinations. Always perception regarding anything they will ask, that is hallucinations. Next question. Misinterpretation of actual perception or real external stimuli is. Misinterpretation. Hallucinations, illusion, C. Limited attention, D. Perceptual organization. For external stimuli, misinterpretation is called hallucination. Next question. Manju sees a design of flowers on a wallpaper and perceive it as an animal. This is an dash. A. Illusion, B. Hallucination, D. Delusion, and D. Ideas of reference. So here Manju seeing wallpaper, on wallpaper she is seeing flowers and she perceives an animal. So here A is our answer. Illusion. So what is illusion? What is illusion? Misrepresentation of real stimuli. So what is illusion? Misrepresentation of real stimuli is called illusion. Here wallpaper, one thing is there, flower is there, but she represented as an animal. So then she is having illusion. Next question. Perceiving a rope as a snake in a dark room. It is an example of, already we said snake, rope is there in dark room. Rope. Actually rope is there in dark room. So perceiving as a snake. So here misrepresentation of rope as a snake. So then we will call what? Perceptual set. B. Hallucination. C. Retinal disparity. D. Illusion. So already if you know, already I have explained so many things. If you know this answer, kindly put in comment box, message in comment box. If you like this video, please like, share and subscribe. Thank you.